You are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of the Ladies' Room. We have another double header today. But first, let me tell you, we're coming up to my favorite time of the year, and that is vacation. Millions of Americans and me plan new adventures for spring and summer, including travel, whether it's for business or pleasure. Many people with medical challenges are sidelined or even homebound. But increasingly, traveling is still possible and even enjoyable with just some advanced planning. Now, in a nod to National Arthritis Awareness Month in May, my guests today are going to focus their comments on people traveling with rheumatoid arthritis. But most of our discussion is really going to be applicable to anyone who either has medical limitations or is traveling with someone who does. And both of them are experts in rheumatoid arthritis, one as a rheumatologist and one as a patient. Now, first, let me just tell you a little bit about arthritis in general. The term arthritis refers to more than 100 different conditions that involve joint pain or joint disease. It can affect people of all ages, and it's the leading cause of disability in the United States. More than 50 million adults and 300,000 children have some type of arthritis. And of course, it's most common among women, which is why we're talking about it in the ladies' room. And it increases in frequency as people age. Now, common arthritis joint symptoms include the classic swelling, pain, redness, stiffness, and decreased range of motion. Symptoms can fluctuate, even within the same person over time, and they can range in severity. Severe arthritis can result in chronic pain, inability to do daily activities, difficulty walking, and difficulty with stairs. Arthritis can also cause permanent joint changes. And sometimes you can see them, as with somebody who's got knobby finger joints, but often the damage can only be seen on X-ray. Now, some types of arthritis also affect other organs other than the joints, including the heart, eyes, lungs, kidneys, and skin. The most common form of arthritis is osteoarthritis. And this is commonly called degenerative joint disease or, wear and tear arthritis, very common in athletes and very common in people as they age. And it occurs as a result of the cartilage or the cushion that's between the joints breaking down, leading to pain, stiffness, and swelling. Now, in rheumatoid arthritis, the immune system itself attacks its own tissues in the joints, causing the symptoms of inflammation, pain, and eventually joint damage and disability if not treated properly. The good news is there are many treatment options. Now, RA affects approximately 1.3 million Americans, with about 75% being women. RA usually affects those between 30 and 60, but it can occur in adults at any age, and juvenile rheumatoid arthritis can affect children. Now, we have two fabulous guests. First, Dr. Grace Wright, who is a rheumatologist, and Maria, who is a woman who's been living with RA most of her life. They're here courtesy of Sanofi and Regeneron Pharmaceuticals, who've paid for their travel arrangements and who are compensating Dr. Wright for her time, but who are not sponsors of our show. Dr. Wright has been practicing clinical rheumatology for more than 20 years. She's in private practice in New York City and an attending physician and clinical associate professor of medicine at NYU Langone School of Medicine in New York, which she must love because she also received her medical degree there, her doctoral degree, and completed her residency in internal medicine there. She's a founding member and president of the Association of Women in Rheumatology, and she's the recipient of several awards for her academic and clinical achievements, and also has authored numerous medical publications in rheumatology. Maria, on the other hand, came to the United States over 45 years ago with the dream of building a better life for herself and her 3 young daughters. Towards this aim, she launched a successful cheese factory, which I want to hear all about because that is my favorite food. When she sold her business in 2007, it was the second largest manufacturer of Hispanic cheeses in the United States. But along the way, starting when she was about 35 years old, Maria began to experience extreme fatigue which of course she first blamed on her grueling schedule. Don't we all do that? But after she sought medical attention, blood tests revealed her diagnosis. Undaunted, she continued to grow the business, raising her girls, often having to resort to supervising manufacturing from a wheelchair because the pain in her legs and feet had become unbearable. But she counts among her many blessings her trusted rheumatologist, who has journeyed this path with her for the past 30 years. And she has become a passionate advocate to help others cope with this chronic autoimmune disease. She lives in Texas, enjoys investing in real estate, cooking, traveling, and spending time with her growing family, which now includes 9 grandchildren and 1 great-grandson. Ladies, welcome to the Ladies' Room. And thank you for being with us. I know that was a long introduction and a lot to handle. But Dr. Wright, could you first tell us what is sort of your classic, typical RA patient? And I'm assuming you don't see children. You just see adults.
I can see teenagers. I don't see children anymore. So, you know, the first symptom that people often dismiss is that tiredness, that overwhelming fatigue that just shuts you down. Because there are a million things that we're doing, especially in New York City, where we're busy even when we're sleeping. So you wake up tired. But in fact, it is the hallmark of inflammation that's leading to all of that fatigue.
Okay, so the inflammation is systemic, not...
Inflammation is systemic, right? The joints are the sort of the recipients of the injury, but the inflammation is everywhere. And so, yes, we see this in swollen, tender, stiff joints, but the lungs, the heart, the fatigue really is that hallmark, and the stiffness that occurs first thing in the morning. You wake up tired and you wake up stiff. And that is really one of the classic signs.
About how long is there between the onset of this fatigue and joint pain?
You know, sometimes it's 24 hours, and sometimes it's a year before patients really sort of realize that they're in pain, not just that they're tired. Okay. So very variable.
And Maria, I was struck by your story saying you began having your symptoms. Do we have Maria? I can't see her. Maria, you there? Here we go. I was struck by your story because I remember when I was taking my medical boards, there was this classic question about a 35-year-old woman who was actually postpartum and who developed extreme fatigue. Of course, the punchline of the story was they attributed the fatigue to the fact that she had just had a baby, but she actually then developed joint pain. How did your story come about?
Say it again, please.
How did your story begin? How did you first get rheumatoid?
Okay.
How did you first something was wrong?
I was 35 years old. I am normally very energetic. And I started noticing that I don't have any energy, lack of energy. And I knew right away that something was wrong. So I went to a doctor, and the doctor didn't find anything wrong. So I went to another doctor until after running some tests, I was diagnosed with rheumatoid arthritis.
And good for you for going to see another physician. Whoever's doing the camera, can we have a 2-shot? I want to see Grace and Maria at the same time. Thank you. We have 2 beautiful women. I want to see them both at the same time.
Thank you.
So Dr. Wright, this is kind of a classic story. We hear this all the time. I even had this in my own life. Ironically, when I was also 35 and I was also postpartum, but I was about 5 months postpartum.
Right.
And I got profound fatigue, but I got migratory arthralgias, which is joint pain. You feel like you're crazy. I remember having read about this my whole medical career, but until I experienced it, I didn't really understand it. Where for 20 minutes, your left ankle hurts and then your right shoulder hurts.
Right.
Your knee hurts and you think you're going insane. So yes. I also, like Maria, saw a number of doctors. And like Maria, I was kind of dismissed by the first couple of doctors who I saw, even though I am also a physician.
Correct.
And I thought I was a credible witness. And they said, you just had your second child in 2 years. What do you expect?
You're stressed.
I said, I'm not doing construction work. And I was an OBGYN resident years before. So I know what extreme fatigue feels like. And this was much worse. And eventually I got to see a rheumatologist
who was pregnant at the time with her third child. And so it did not occur to her that this had anything to do with pregnancy at all. And she basically said, okay, you have rheumatoid arthritis or you have Lyme disease. And in my case, I had tertiary Lyme disease, which came as a surprise because I had not been outdoors at all. So I'm blaming the dog. But talk to me about what steps you go through as a physician when a patient comes to you. I'm assuming most patients come to you having seen other doctors first.
Yeah, I've had patients where I'm the 10th or 12th doctor that they're seeing because, like you, they get dismissed. When somebody is young and looks healthy, they're assumed to be healthy, they're assumed to be stressed, working hard, or you're traveling too much, or you need to eat differently. There are a million and one reasons. And I think the most important thing is to really listen to the person. What exactly are they telling you? Now, you give the story of the stuff that is migrating, and there are sort of classic things that follow that. Rheumatoid arthritis tends not to be a migratory arthritis. It may be symmetric or it may be additive. It comes and then another one comes and then another one comes, and then sometimes you have 30 joints involved all at once. But listening to the story is critical to make the diagnosis.
In RA, is it more common or less common for symptoms to be on both sides of the body or just on one side predominantly? Or
So RA is classified as a symmetric disease because it tends to present simultaneously on both sides. So it may not be a lot of joints all at once, but you'll see things if it's on the left hand, it's in the right hand as well. Men tend to present with more large joint disease, and so sometimes that's missed. The subtlety of having symptoms in both hips may not be as obvious. Shoulders are often completely overlooked because you can compensate for that loss of motion.
Right.
But RA is symmetric, so you'll see it on both sides.
That's great. And Maria, did you have it on both sides, or which joints were the most painful for you when you first started out with RA?
I have it all over my body, but my legs were most painful when I was there. After I was diagnosed, like 6 months after I was diagnosed, I started getting a lot of pain on my legs.
Mm-hmm. And what is the, Grace, what is the genetic connection with RA? Is this something that tends to have a strong family history, or do people have a family history of other autoimmune diseases?
Well, so we tend to see what I call the autoimmune pedigree, where you'll see a sprinkling of different kinds of autoimmunity throughout the family. And family meaning uncles, aunts, cousins, second and third degree relatives. Mm-hmm. There are genetic linkages, and so there are some clear families in which you'll see this sort of tracking down, but it's not like diabetes where you'll see this happening in every generation. Mm-hmm. This tends to scatter. I call it the autoimmune sprinkle. So I may hear about an aunt with scleroderma, an uncle with lupus or something that looks like lupus, and then I have RA. So it really varies, but it's the presence of autoimmunity that we see tracking together.
And Maria, did anyone else in your family have this before you had it or since then?
No, not that I know. I mean, my parents both were orphans, so I don't have a good history of the family other than my parents and my siblings, and nobody has it.
And what about your children and grandchildren?
Thank God, no. It's a blessing to know that not until now, everything is okay with them.
That's great. So now let's talk about what everybody is dying to know. Let's talk about treatment, because, back in the day, people just kind of took aspirin or over-the-counter pain relievers and just kind of dealt with it.
Right. And now we know, now we know differently. So you mentioned I'm here on behalf of Sanofi Regeneron, but there are really multiple treatment options, and we can really work towards customizing things for each individual. So the young woman who's planning pregnancy, there's certain medicines that we don't use because you can be pregnant and you can have a successful pregnancy and raise children. So we have pills, we have tablets and capsules, we've got injectables that patients self-administer, we have other agents that we infuse either in the doctor's office or in the hospital that really target the underlying cause of the disease. We no longer just treat the symptoms. We no longer just say, you're in pain, take something for pain. You really want to target and shut down this disease because, as you mentioned, joint damage occurs, and that is often irreversible. We have patients having to go to have joint replacements. If we can preserve the joints and prevent those surgeries, then that's a good thing.
So you mentioned pregnancy. Is RA something that is ameliorated by pregnancy, or is it something that pregnancy is a stressor and a flare?
Well, we used to think that everybody went into remission with RA, so that if you complained of symptoms during pregnancy, it could not be RA. But the truth is that it's about a third of women actually have flares during pregnancy with RA, and the most important thing is to be in remission, to be very well controlled before pregnancy, because that increases the odds of you, number one, conceiving and going through the pregnancy with fewer flares. So it's possible, but it requires close management.
So the number one message there is to plan your pregnancies.
Plan, and what we found is that most pregnancies, at least the first, are not planned.
Right.
So we have to start talking about that the moment we make the diagnosis, so that we know what to do.
On this show, we talk a lot.
Yeah.
50% of all pregnancies in the United States are still unplanned, which does not mean unwanted necessarily.
Right.
But it means that we didn't take the time to correct any medical issues that we needed to correct
beforehand.
Now, in the intro, I talked at great length about how we were going to get to travel and travel tips, because in the past, people who had severe pain or difficulty walking or problems with stairs were really pretty limited. But I think a couple of things have happened. Certainly, we have much better treatment options for people. So in terms of planning, I assume many of your patients come to you and say, I'm planning this big trip. We need to really get this under control before then.
Yeah.
But certainly the travel industry has really become much more friendly to people who are using wheelchairs or canes or who need elevators or escalators. And I have some leg issues. I like to say I was attacked by a man with a knife, but it was complications of surgery. So I also have walking issues. And I've really noticed big improvements in sensitivity in people in the travel industry to this. But Maria, how has this affected your travel plans?
Really, I love to travel. I travel a lot now. I've retired, so I travel for pleasure. Always someone in the family goes with me. They're one of my children or grandchildren to assist me with carrying the luggage. I also have a scooter that I take with me so I can move around at the airport to go from terminal to terminal. And that gives me a lot of freedom. Traveling by plane is very challenging because I tend to get a lot of swelling on my feet, and that's very uncomfortable. But after takeoff, I try to get up and walk. That helps. I carry with me some lotion so I can massage my feet. That helps too. If I travel by car, I try to stop every 2 hours to get out of the car and walk a little bit so I can get some relief from my swelling and stiff joints.
See, most women of a certain age have to stop every 2 hours to use the restroom. So.
Right.
So, Dr. Wright, would you like to share some of your tips that you have for patients who are dealing with not just rheumatoid arthritis, but really any kind of rheumatologic disorder?
Yes, I say,
to address the airplane issue.
Yeah, absolutely. So it's important to plan, right? And planning starts with, what am I packing? What am I wearing? What do my shoes look like? How heavy is my suitcase? Check the suitcase if at all possible so that you're not dragging this along with hands that have been damaged or shoulders that have been injured by whether it's rheumatoid arthritis or another kind of arthritis. So to make use of these advantages that we have in travel, ask for help. If I don't have my own scooter, ask for help.
Advances are suitcases with wheels.
Absolutely. 4 wheels are the best invention.
4-wheel drive.
Absolutely. And that really helps and allows you to become more mobile. In this country, we have a lot of access. There are some countries where we don't have as much access. So it's important before you make a travel plan, figure out what that country has to offer so that you can know how you're going to get around when you get there so that you, in fact, can enjoy your travel. And then on the airplanes, get as comfy as possible. Have a neck cushion to support the neck. Many patients with RA have neck issues. Move around, walk up and down the aisles, or as I say, wiggle in your seat so that your joints don't get frozen and stiff. All of these little things are helpful. And then finally, hydrate, and again, hydrate. We forget to drink when we travel, so it's important to do that.
And we're talking about drinking water.
Water, absolutely.
Not alcohol. What is the effect of alcohol on our...
Well, it dehydrates. And so it's the exact opposite of what it's not that you can't have a fine glass of wine, but just remember to drink water and hydrate.
Yeah, what I always tell people is a full glass of water for every alcoholic beverage. One of my tips is when you're on the plane for anybody, because for people in general, of course, we're concerned with economy class syndrome and blood clots. So I always recommend that if you can't get up, do the alphabet with each of your feet. And of course, practical shoes.
Exactly.
Yes.
I recommend taking them off when you're on the airplane. So please wear socks. But if you do the alphabet with your big toe and really exaggerate that, that can really help with that lower calf and the ankle flexibility. So talk to me about some of the other triggers for flares of RA.
So stress can be a trigger, infection can be a trigger, not getting enough sleep can be a trigger. It's important to rest. You switch time zones, you're traveling long distances, remember to catch up on that sleep and rest. And we have lots of helpful tips on the RA website, yourramoments.com, which really gives us many useful things that we can apply either for RA or other chronic inflammatory diseases as well. So you can live and travel.
And as far as traveling, probably the number one issue with the planning begins with planning where you're going to go.
Exactly.
So probably traveling to New Zealand, while it is lovely, and I'm glad I was there before I had mobility issues, is probably not a great idea because the flight is ridiculously long. I'm a big fan of recommending cruising to people who have mobility issues. First of all, because there's on any major cruise line, they generally have a fully equipped medical facility and medical staff on the ship, which I have toured on many occasions, and I've been so impressed.
And I totally agree with you on that.
So are you a fan of cruising?
Easier to take a cruise than any other trip.
Yeah, I've talked to people who've had kidney dialysis on cruise ships, and they can be very accommodating. Plus, if you are using a scooter or a wheelchair, the aisles on a cruise ship are very, very easy to navigate.
Yes.
When traveling with other people, they don't have to be limited by your limitations. They can go off and do all their activities, and you can enjoy, something more sedentary or relaxing on the ship, which I really like. But Maria, how did you become a RA advocate? What made you decide to use your voice to help other people?
When you live with RA, you totally sympathize with other people who are diagnosed with that, and you want to share what you know to make that person's life easier, because living with RA is challenging and is painful, and by sharing with other people is my way to give back, to help.
That is wonderful. And Grace, tell me how you decided to become a rheumatologist.
I just wanted to help people, young and old, and be an advocate and really help physicians advocate for patients and patients advocate for themselves. So thank you so much for having us
to
discuss this. It's been our pleasure. And again, yourramoments.com for useful tips and tricks for living and traveling, even to New Zealand with RA.
Thank you. Thank you both for coming, and enjoy whatever vacations you have lined up. I didn't even get to ask you that, but I know you have to go on to your next interview, and thank you so much for coming.
Thank you so much.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.